Um, Lenny, first of all, I'd like to thank you for coming today and being here in the office. Um, Nancy has talked with me. We've had several sessions about some things that are going on in her life. And she actually wanted to meet with you here in the office together, but she asked, and maybe this was a little out of the way or out of the ordinary, before we do couples, she wanted me to meet with you. She's got some inhibitions or some hesitations about speaking and sharing with you what's going on with her. And so she kind of wanted me to be that segue, that bridge, if you will, between you two before you actually have that open conversation. Are you aware of her meeting with me?
Yes, I am.
Okay. So I want to be candid and open. I want you to know that feel free and comfortable with speaking with me, as Nancy has. She has shared some intimate details with me about herself, more or less. Very little about you, actually. But at the end of our session today, I'm going to tell you, share with you what I shared with her about some techniques and some homework exercises that she can do that she will need you to help her with. Okay? And I would ask that you speak up just a little bit.
Okay.
All right. So let's begin with why Nancy actually came into my office initially. Nancy shared with me that she is a breast cancer survivor and that you were there with her through that journey.
Yes.
I understand that breast cancer and what happens during the course of the actual diagnosis and then maybe all the treatments and surgeries or whatever. You want to share with me just a little bit about Nancy's journey with that and how that maybe kind of affected her or changed her in some way?
All right. First off, it was very, very scary at first for her because she really didn't know what to expect. And I guess when you hear the word cancer, it automatically has a lot of emotional ties to that. So, once she got past that and then she was ready to face the initial treatments, she was still a little bit apprehensive, but okay, very, very strong, very, very ready to go through it. Now, once she began, she had, I believe, a surgery first, and then she began the chemo treatments. It was a very, very rough time. A lot of changes in hormones, actual body, the way the chemo or the medicines affected her body would leave her very, very tired and emotionally drained, almost a personality change. So it's almost for 6 months to a year, it was almost like she was a different person from time to time. There would be days where you just wouldn't know that she was the same person. And in a lot of ways, I think it still affects her that way today. So it was I'd never been through this type of thing before with anyone. So it was new, it was different, and it was a really hard thing to go through for her, I know.
Okay. I understand that it was a tough time for both of you. I heard you say that you've never been through that kind of thing. And so I can only imagine, we can both probably only imagine what it was like for Nancy.
Right.
Yeah, and all the changes that she went through. I want to back up for just a minute and talk about pre-cancer or before cancer, if you will, for just a little bit. Nancy shared with me that she is divorced, and so are you.
Yes.
Correct. And that you both have children.
Yes.
Okay. And let me ask you, if I may, what was your relationship like? And we're talking sexual here, your sexual relationship, your intimacy like before breast cancer?
It was a really, really good experience. I mean, we had known each other for a long time, and we basically, if you will, grew up together, sexually or intimate or whatever you want to call it. So it was, let's put it this way, it was never dull. There were never dull moments. So I think we were both quite satisfied
Okay.
in a lot of different ways.
All right. And so there were no problems between you guys sexually.
No.
Your intimacy was good.
Yes.
Okay. And how did you tell me how you viewed Nancy before surgery, before cancer? What were your thoughts about Nancy's body image in your mind, your perception?
She turned me on in a lot of ways, if you will, just to put it bluntly, I guess. Touching, feeling, everything that you could want in a body. Her body was great to me. Now no one's body is perfect. As you look at the pictures in the magazines and whatnot, and you go, yeah, that's perfect. No one was like that. But in my mind, she was perfect for me.
Okay.
So if that's what you mean.
Yes, I do. And so she was perfect, and
For me.
for you, and I understand that you enjoyed being with her, and it sounds like you both enjoyed being with each other.
I think so.
And then the cancer diagnosis came, and what I heard you say is some things changed.
Mm-hmm.
Can you tell me about the changes?
After the surgery and the chemo, I think there were, especially with her in her breast area, there was some body changes. Now it didn't bother me, but I felt that she was self-conscious about those changes. And there were differences, but it wasn't anything major to me.
Mm-hmm.
But in her mind, I believe that it was. And as far as being intimate, her body almost like went through maybe a menopause type phase or something, and she wasn't as I don't know exactly how to put it, not necessarily willing, but the emotions and feelings were not quite the same.
Mm-hmm.
It could have been in her mind, and it could have been changes in her body, but overall there were differences.
Okay, you said the emotions and the feelings. So, can you elaborate on that a little bit? Like, Nancy, you guys still, I'm going to throw this word out there. I haven't heard you use it, but Nancy's used it with me. Do you feel as though the love is still there?
Yes, there were times, that did come into question in my mind, but I feel like the love was still there, but emotionally, I think she had some changes within. I don't think it was necessarily had a whole lot to do with me, but I think it was just an emotional change from within.
Nancy shared with me that before cancer, and you can tell me, if the stories align between you guys, that before cancer, she was, I'm going to use this word because she used it. Nancy has a sense of humor, if you will. And she used the word vivacious. That, she was hot for you all the time. You want to elaborate on that a little bit, or do you care to add to that?
I wouldn't say all the time, but yes, she was, and that was what I think was an emotional change. But I tried to understand because I was there when she went through that period of time. So I tried to understand. Now, keep in mind that wasn't always easy because I was still normal in my mind, what normal is. I was still normal and I still wanted her, but there would be times that I felt like she either wasn't feeling it or whatever, and that was different. That was a hard thing to adjust to.
And when you say you felt like she wasn't feeling it, can you maybe describe what that looks like, what that sounds like, even what that feels like?
Well, we were together a lot, and it's like she would find other things to do. If it were bedtime, she would come to bed late, or she would just get in the bed and maybe even turn her back, or just get in the bed and grab a book or her phone and find something else to distract her. And it could have been me, the way I took it as a brush off or a wall that she was putting up. And like I said, it could have been me, the way I was reading the signs, but I don't think so. I just think that she put those walls up to kind of keep me at bay. She made it very hard for me to know when to try to become intimate or not to be intimate. So it's not real easy to describe, because like I said, part of it could be in my mind and part of it could have been exactly what was going on. She just wasn't feeling it. She wasn't hot, as she put it, and didn't want to be intimate, and so it made it very hard for me to understand and know when to make a move or whatever, or not to.
So it kind of left you in limbo. You're like, I don't know whether I should cross this line, whether I should tap her on the shoulder. Is that
exactly?
Okay. She shared with me that she didn't have a mastectomy. So I heard you say a little while ago that there were some differences in her body. She had a lumpectomy. Lumpectomy. So there were some differences, but nothing that would just make you feel any differently.
No, not
make you feel any differently.
No.
Has she ever shared with you how she's felt about the changes in her body?
Not anything in depth that I can recall, but she's made a statement a couple of times. I need to have a breast job so they're both the same, because they're different, because the side that she had the surgery on is different in mass as opposed to the other one, which I can tell the difference, but it doesn't bother me. But she's just mentioned that to me, so I feel like that's something she has an issue with.
I want to be very open with you, because this is what, this is how we get to actually what's going on. And Nancy mentioned to me in one of our sessions that I don't know which one he likes more now, because and we kind of laughed about it when she was here, because she said, how men have a special side, a favorite, and some men even name them, correct? So I don't know,
No.
Yeah. So but anyway, she shared that with me, and so I guess this is something that I told her that she needs to talk with you about, and she's very shy and timid sometimes, it seems, when it comes to that, and so we're working on that. But before, I guess, she told me that she felt like she could just feel that they were special to you. And somewhere in her mind now, she's doubting. And I believe this is what we're trying to get to, that it's her doubt and nothing that she's really getting from you. You want to?
Yeah, I agree with that 100%, because actually whenever we are intimate and I'm paying special attention there, I try to consciously make an effort to make sure that both sides get equal attention, so that she doesn't think that, because I do know that, because she's mentioned that a couple of times, that this side is different, this side I want to get it fixed or whatever. And so I have consciously made efforts to make sure that both sides get attention.
I find this interesting, and I don't know if you heard yourself when you said it. I subconsciously or consciously try to give both sides equal attention. I want to ask you something and just put it in your mind. Have you ever really talked with her about that to allay her fears and to actually, what do you think about telling her they both mean the same thing or letting her know?
Well, I don't know, maybe in just a quick conversation or nothing in depth that I can recall that we've ever spoke about that. I have told her I like them both. I don't, doesn't make me any difference. But that's like, in quick, there's been no in-depth conversation about it though.
Okay. So if I tell you that she's struggling with that body image, could you see that? Could you?
Yeah, I mean, I can see it because I know how she is about her image overall. So no, that's not far-fetched at all to think that she would be conscious of that.
Okay. I want to talk just a minute. So it sounds that you really know her and that you guys are pretty close and pretty open. But here Nancy's having some self-doubt, if you will. And she's going to need someone to help her with that. And that person is you because you're her significant other. And so I have actually, we've worked together in the office. We've talked about some things that she could possibly do. One thing that's come up even now between the conversation, you and I, is the need to be open, to have intimate conversation and candid conversation about how you feel about her. Because what we need to do is help Nancy accept her body the way that it is, if that's what she chooses to do. I heard you say she's thinking about having some surgery or something. That's fine too. But from your point of view and your perspective, she's just fine the way she is. Sometimes we need to hear that and really hear it, not just in a passing conversation maybe, but actually sitting down talking. One of the best times for couples to have this intimate conversation is when nothing else is going on. The TV is off, the phones are put away, and it's just you guys one-on-one. Whether you're lying in the bed, whether you're out having a cozy dinner for two, and that can start your intimate conversation. Right? Do you ever have intimate conversation with Nancy?
All the time.
Okay.
It may not be anything as specific as that, because usually when we're having just a conversation just between us two, there's a bevy of conversations or a bevy of topics. Talk about a lot of different things. And that's one thing we've always had is a lot of conversation about a lot of things. But I don't recall one in depth about her body because in my mind it's fine, and she should know it's fine because I say it and I say it. And
would it make sense to you now that maybe that is a conversation that you could possibly have with her?
Yeah, I can see that it might be something that she needs.
Yes. When you let's try this. When is the last time, if you did, the last time that you had intimate conversation about your sexual of a sexual nature? Do you remember? Do you recall?
A long conversation or just in passing?
Either or, anything that stuck with you.
Well, the last time we were together intimately, a week or so ago, it was just really quick, and she mentioned something like that, and I said, it doesn't matter to me. But then the conversation wasn't very long. It's just a quick throw out of, I like you just the way you are.
Do you remember what she said?
Something to the effect of what I told you earlier. I want them to be the same. Speaking of her breasts.
And what was your response or reaction or?
Not really a reaction because I've heard it before, and my normal, me being who I am, response is I like them just the way they are.
Mm-hmm.
And to me, that's enough. For her, that may not have been enough in having this conversation, but to me, that was enough. You're fine the way you are. They're fine the way they are.
Mm-hmm.
You don't need to change a thing.
Okay, so when Nancy mentions that to you next time, do you think your response will be a little different?
My response would be different.
Yeah, do you think it will?
I may have a few more questions, but I don't really see my response being totally different, because my response is going to be the same. It just may go a little more in depth if I feel like she needs some more reassuring.
I suppose that's what I'm asking. So that was a good response.
Yeah,
from you.
if the conversation developed, and I would say exactly what she needs to hear.
Okay, but what she needs to hear.
No, I'm not saying what she wants to hear. I'm saying what she needs to hear, which would be the truth.
Okay.
Because what I say in passing is going to be, it's not going to change.
Right.
You're fine the way you are. You don't need to change a thing. I'm not the type of guy, and she can probably tell you this, that's going to say what you need to hear just for the sake of saying it. I really try and say what I mean.
Mm-hmm. Okay. I can appreciate that, and I'm sure Nancy does, because we have very limited opportunity to meet people who say what they mean and mean what they say. And who don't sugarcoat things. That's what I hear you saying. I don't sugarcoat for anyone. Yeah.
Try not to.
So, what I would like to know is, Nancy mentioned the breast cancer. Okay. You're mentioning the mass or the size, maybe. It's what she's told me, what she shared with me as well. She's mentioned that she has some different feelings in that breast. Did she ever mention those things to you?
Every now and then she'll say she feels something different, or does this feel like something, which is exactly what she said to me right before she was diagnosed. She could feel something, and she had me feel it. And of course, I'm not a physician, so I couldn't tell the difference. And she could, because it was her body. Mm-hmm. So I just feel like a lot of times that it's that fear, that emotional scar, mm-hmm. that's probably never going to heal. And anytime she feels something that's different, there's a little fear that comes back. So, but yes, she mentions that from time to time, that something feels different, there's a itch or something. She'll mention that from time to time.
Yeah. So it sounds like, okay, we have two things here. Her body went through changes, right, which affected her and her feelings, if you will, and maybe her sexuality, because it sounds like she kind of changed and withdrew a little bit after the diagnosis and the treatment and the changes. And then the other thing that you just mentioned, the fear, I guess, impending fear, mm-hmm. that maybe that cancer mm-hmm. may return.
Right.
So if she was so very vivacious before, and now there's almost a tendency to not go all out. Mm-hmm. Is a wall? Is it a safety net?
Right. Yeah. She's always been pretty good in all areas of being able to put that wall up as a protective device. I do it. I mean, I think most people do. Mm-hmm. But she is the one that I know best, is really good at it, to protect herself. But the thing that I've learned over the years is that, which I'm not a very patient person, which is part of a bit of my issue. She puts that wall up, and I see it as that wall should come right back down. She's different. The wall doesn't always come right back down. It may take 2 or 3 days. Me, I think it should be a couple of minutes. Get over it and let's talk about it and move on. But that's my impatience. That's me. It's not her. And so we have some issues with that, because she's, to me, is very good at putting that wall up. And so, which I think is part of her protective devices now, is I don't want to go back to that feeling that I had before, so I'm not going to go all in, so to speak.
If I had to ask you before cancer, before the changes in her body, which she tells me that she, before cancer, had been exercising and had kind of gotten into some kind of shape that she, physically, that she really had strived to get to. And she was feeling really good about her total being. And then this happened to her, with her. And then she kind of lost her edge, if you will. Her words. I just lost it. Couldn't do it anymore. And she mentions that, of course, that you work out and that you are buff and you're always going, and that, he's got this great stature, if you will. So before breast cancer, what was your sexual contact like? Your intimacy? How often was it? You understand what I'm asking? I guess.
Just about every chance we had to be alone, even sometimes just for a few minutes, or sometimes for a weekend. There was no schedule. It's not like maybe tonight, if she wasn't tired, which before breast cancer she was really never tired, even though she worked as much and did other things as much, she was never tired. So it could be 2-3 in the morning she woke up, or I woke up and feeling it. That's what happened. But now it's she's tired more often. Between work and school and kids and other things, there's a lot of tired times. And that's something I had to get used to, or because it was totally different.
Right.
Because from before it's like, you got to give me a break, and now it's like I don't ever need a break. So you know what I'm saying?
Yes.
It did change. It was we were very active intimately, and now not so much. But when we are, it's still very good. It's just that the spaces in between are totally different from before.
Good way to describe it. So if you had, of course, she and I have talked about this. I don't know if this question is just, would you want to return to pre-cancer intimacy?
Yeah, that's a pretty easy question. Who wouldn't? I mean, I would.
Okay. All right. So it sounds like, it's a done deal. That's what I would love. So the question is, I guess, where we've reached with Nancy right now is, how do we get there? How does she get there? How does she start feeling better about herself?
To me, and she knows I'm a planner, you have to I always set out almost exactly what I'm going to do, where I'm headed. To me, to get there, you got to lighten the workload as much as you can. Set aside times to do certain things, like if you have homework or if you have schoolwork, set aside a time to get that done. And then you have to set aside times. This is my time, not necessarily intimate, but my time. And to me, 9 times out of 10, if you set aside that time that we're going to do something together, it's going to end up being intimate the way we were, in my mind.
Okay, so you answered the question. So it's like whenever you find the time to be together in one-on-one time, it would generally go in that direction.
Yeah.
It's just going to happen. It's like an automatic. Okay, so she mentions to me that she had some issues with neuropathy, and we understand what neuropathy does to our bodies. It affects the touch. And so I just briefly want you, before we move on to what you just kind of helped me get to, briefly talk about her touch, because she explained to me what it's like for her, before and during and after. But I want to know from your perspective what that was like and how it changed, if it did.
To me, as far as what we talked about and what I knew, we didn't go in depth about that a lot. Now, I knew she had problems with her feet, problems with her feelings, but I don't know how much that affected our contact. I really don't know.
Okay, can you tell me before cancer, what was it like for not I don't want you to tell me from her views, because of course you can only go on what she's told you. But I want you to tell me what intimacy, as far as intimacy goes, what was her touch like to you? The feeling of her touch, the frequency of her touch. When we're talking intimacy and sexuality, what was that like before cancer for you?
She's like, just like the intimacy overall. She was very touchy-feely, always touching, grabbing, touching, all the time. Mm-hmm. Now, I don't know if it was because of the neuropathy or if it was from the other issue that I thought of. So that's why I say I can't really answer this, because I don't know why that changed. Was it just the overall intimate experience, or was it something to do with the feelings?
But
I don't know.
The question is, okay, and that's why I said, I know you can't tell me from her, but that's what you felt before. It was very sensual, if you will. Yes. And then at some point it changed. Okay? Less, different feel, no touching. Can you tell me?
No, there was still touching, just not as much. Mm-hmm. If I have to think back, mm-hmm. It's not as much, but even but it was still there. Mm-hmm. So I guess in my mind, I see that as an overall picture, not just a touching. Mm-hmm. What I see.
One more thing. If she mentioned to me that, and she said it with such a smile on her face, and so I know that this had to be really near and dear to her, and she felt strongly about it, and that you guys evidently have shared this topic, that the special part of her body and the special part of your body, and she mentioned when you guys first met that she didn't think that you were necessarily a breast man. Her words were boob man. He wasn't a boob man. And she didn't know what you were. And at some point she said, I really think he fell in love with my boobs. So you understand where we're coming from, how she can feel this different, have this different view about her body image, because that's what she feels like you fell in love with. Now, she mentioned also that there's a special part of your body that she really loves to touch and to feel and talk about and talk dirty, if you will, to you about that. And are you aware that there's a special part of your body that she really enjoys? I'm not going to ask you what it is.
Yeah. She's mentioned that.
Several times? Once?
Yeah, many times.
Many times. Do you believe that to be the case? That she really enjoys that part of your body, or that really makes her feel a certain way?
Yeah.
And if so, why?
Because she does go there all the time, or she did more so then than now, but and she says it over and over and over.
So consistency.
Yes.
Consistency. That's very good. Now, so, and if you had to have a special part of her body, do you have one?
Yeah.
And do you care to share that? You don't have to.
It would be the part that we've been talking about all day.
Great. So okay. So we touched on something there, which is really good, right? That before she felt, I guess, I don't know, maybe even a sense of pride about that, because to see her face beam about it, I could tell, yeah, she's very proud of that. And then to go through this ordeal, which I know you felt, and you were there with her through it all, and then for it to bring about so many changes in her. Okay. And you said the consistency of her saying and showing you and telling you, this is the part that I like about you. So maybe in your mind, you're thinking, I already told her, But I'm going to ask you, can you see maybe a need to be a little bit more consistent and build her up where she's lacking in that area?
Yeah. If I made a conscious effort, when you tell me, I don't say anyone, when you tell me something and I go, okay, maybe that's true, I would definitely make a conscious effort to reassure her of that.
Yeah. I understand that you're like a sports dude, and sorry about that, but that you could almost coach, and that you have a daughter who plays, and you're always adamant about coaching her. Say, for instance, if she's off on her shot on a free throw, right? She needs to step over a little bit to the right and back an inch or two, right? You're going to those very details to make her better and to make her more consistent and to help her feel really good about what she's doing. Okay. So I guess I'm going to ask that you, and you're not going to stop until she gets those free throws, right? Until she feels very secure and confident in what she's doing.
Right.
So I guess that's what I'm going to leave you with and what I'm going to charge you with. I don't want you to stop until you make sure that Nancy is very confident and secure in how she's feeling and what she's feeling. Can you do that?
That's actually like a fun charge, so so it would not be a problem.
So here's what I wanted to do here. I'm glad that you came here to see me today, that you agreed, because I think that you tell me, do you think this is going to help open the communication between you and Nancy to where you can help her address some of these issues that she's having with her body, the image of her body? Now, she mentioned a couple of things, and I just kind of really wanted to touch on that today. Of course, she tells me that she's not in the same shape that she was in before breast cancer, but she's going to work on that. And I believe it, because she seems like she's a very determined individual.
Yeah, that's what she tells me too.
Yeah. So I think that she would love for you just to not necessarily be her daddy, as far as being that person who's overbearing and telling her what to do. But I think more or less she needs you to help her along a little bit. Does that make sense? A little bit at a time. She doesn't need that overbearing person. She needs that significant other who loves her and who helps her to feel that love. So overall communication, if you will. It sounds like you have great communication, but the communication needs to touch upon these things that sometimes we're not so openly able to discuss, sexually, dealing with our sexuality. So for homework, what I gave Nancy, this is going to sound a little odd, maybe, because Nancy tells me that, okay, when you guys are intimate, lights on or lights off?
Off, because she likes them off.
She likes them off.
I don't care.
Okay, you don't care. Showers together, showers
No.
apart. Okay. Does she walk around naked?
No.
Do you walk around naked?
No.
Okay.
I mean, briefly, but not not just strolling around. No.
Okay. All right. How do you feel about that? Walking around.
I don't know. I really don't. Have never given that much thought, because we've never done it. So it's not a big deal.
Great. Okay. So that's good for me because I wanted to know if maybe before cancer there was this nakedness and openness, and then after cancer you guys kind of.
No.
Okay.
This was never.
Okay.
This is something that was never done.
Okay. Now, would you be opposed to that? Maybe.
I wouldn't.
Okay. Have you ever just, for yourself, have you ever just stood in the mirror?
Never just what?
Stood and looked in the mirror at yourself from head to toe, unclothed.
I suppose I have.
Okay, all right. And how do you feel when you're looking at yourself? What are your thoughts?
Honestly, I look and I'm almost a perfectionist. So I look and I go, I need to work on this area, that area, or something. I don't look at the mirror and go, okay, I'm perfect. I don't do that.
Okay.
So I think there are things that I could fix.
And I believe we all feel that way. So when you look at Nancy, though, when you're looking at Nancy, are you looking at her saying, that's imperfect, you need to fix that? What are you looking at when you see her?
Yeah, and I don't look and say she needs to fix that. But I might look and say, she's not perfect, but that's okay.
Okay.
It's okay.
Okay. So what I'm getting to, her homework assignment is to actually sit down and write affirmations about her body. Affirmations in her thoughts. For every negative thought that she has, for instance, I need reconstructive surgery. She needs to write down 2 or 3 positives about herself. I love my eyes. I love my shoulders. My skin is soft. You understand what I'm saying? So for every negative thought that she ever has about her body, she needs to write down 2 or 3 positive affirmations. So I want you to help her with those affirmations. Because it sounds to me as though you love her, you like what you see, you enjoy what you have, and she needs to get to that point and feel really good and positive and be assured that you do feel that way. So I want you to help her with those affirmations sometimes. Maybe when you come in from work and you say, hey, Nancy, and give her an affirmation. Just give her a quick something, and so she feels better. The other thing is I've charged her with looking in the mirror at herself, fully unclothed, and learning to just love and appreciate what she sees. Okay? So it sounds like, though, I may need to charge you with that too. Because your thing to me was, when I look, I don't see perfection, I see imperfections. Okay? And we only get one, right? Body. So I need you to look for those perfections, those things that you can celebrate, if you will, that you have, that you are happy to have, and that you're blessed with, because the Lord has blessed all of us, So I want you to do that. And then she's going to be looking at herself. Now, you told me that, we don't really walk around naked. We don't really... How much, just to put this in your mind, how much would it be for you to one day find yourself in the mirror with Nancy, and you can be fully clothed and start off in that manner, and have her look at herself, and you ask her, Nancy, what do you see? And when she tells you what she sees, I want you to tell her what Lenny sees. This is what I see. And start from there. And then maybe at some point work your way to having maybe shoulders, Nancy, what do you see? This is what I see, and maybe just work your way a little bit. And even if all of this can't be done in front of a mirror, maybe when you're intimately lying in bed, maybe she'll let you turn the light on a little bit, or and maybe you won't need the light, but you can just tell her, this is what I see. These are the curves. This is what I feel. This is what I see. Do you see it? Start that way, because that is her homework. to really assess herself and find all of the beauty that she can in herself. She has to accept herself before she can accept what you're saying. She's got to be able to accept those things from herself. So the next time that we will meet together. But this will kind of be the segue and the bridge to you guys starting that conversation. And then when you meet back with me next time, you can kind of tell me where you are in it and how that's helped,
Okay.
maybe. And maybe this intimacy that you guys have kind of found to dwindle a little bit, maybe that fire would be rekindled.
That would be good.
Would it?
I'm just saying.
Okay. So do you have any questions for me, or?
No, I can't think of anything. I think you've covered quite a bit. So no, I don't have the questions.
Okay. So I really appreciate you coming in today. And I look forward to speaking with both of you the next visit.
Okay.
Thank you.